Measles claims another young life. Tariffs hit the healthcare system and everything else. And Medicare says no to GLP-1 agonists. This is America Dissected. I'm your host, Dr. Abdul and Scott.
And I'm your co-host, Dr. Katelyn.
And we're recording this on Tuesday, April 8th at 9 p.m. Eastern Time, where tariffs are tanking the global economy. This week, it's National Public Health Week. So, friends, we feel your pain, we appreciate your struggle, and we salute you. But it is absolutely deeply hard to celebrate after just another exhausting week for public health. Before we get to the news, I want to take just a minute to acknowledge just what's happening here with a bit of a temp check. Katelyn, what's your temperature?
Temperature's not good. I don't know. It's been really, really hard. And I keep having conversations with a lot of my public health colleagues, obviously, and I think the general consensus, and I totally agree with this, Abdul, I'm actually curious what you think from your position, is that this is harder than COVID, honestly. And I think the reason for that is because COVID, there was one nemesis, right? There's one problem we needed to solve, and the whole world was hyper focused on that problem. Now we are fighting fires in literally every direction. I'm so overwhelmed. I don't know what plug to put my hands over it in this ship. People are getting laid off from work, from jobs. Senior leadership is gone. HHS is being restructured. Departments are being combined. USAID is gone. There's major cuts to the VA. All of this to say that also, hey, we're having an incredibly bad measles year. We have avian influenza. We just got off one of the biggest flu seasons of the year. There's vaccine disinformation coming from the highest office in health. There's funding cuts at NIH. It's a lot. How are you feeling, Abdul?
Yeah, I would say feverish. And I agree with you entirely that this feels so much harder than COVID, right? There was one central story and all of it kind of emerged because of the emergence of this virus. Now you literally have chaos actors at the highest level of government who are literally doing all the worst things of the COVID crisis. And I want to stop for a second here and talk about the tariffs, because at face value, we wouldn't think of this as a public health story. But we talk a lot about the, quote, social determinants of health. And yes, it's a running thing on the show that I absolutely hate that term simply because it doesn't mean anything to anybody. But let me just explain what it does mean. It means that the things that happen in our lives affect our health in really profound ways, and they disproportionately impact the most vulnerable people in our society. And so when you look at the tanking of the stock market because of an effort to drive all the tariffs at the same time, yes, right now it looks like a global market sell-off. But if you're a stock trader and you're worth $1 billion, you might have lost 100 million of that. And on paper, that's a lot more money than the person who is getting ready to retire and lost 10% of their 401k, right? They might have lost $50,000. But they were hoping to rely on that $50,000 to live for an extra couple of years, right? So the impact on those folks is profound. And yes, the majority of people own no stock. But what you're talking about when you talk about the stock market is the value of companies across this economy that people work for. And so what tends to happen when they're not making big investments is that people tend to lose their jobs. And that's what we saw during the Great Recession. That's what we saw during COVID. And unfortunately, that's what I hope we don't see, but is likely what we're going to see because of tariffs. And I want to be clear about something, right? I actually think that the decisions that we made through the 90s and 2000s on free trade were bad. They hollowed out huge portions of the industrial Midwest where I come from. But this is like diagnosing a cancer and then deciding to give the patient all of the chemotherapy at the same time, right? And you're like, all right, let's feed them all the chemo. Do you know what happens if you give your patient all their chemo at once? They die because chemo is poison. And so you can still believe that targeted tariffs could be a good thing and recognize that this is exactly not the way to do it, which of course should bring back echoes of everything we've been seeing from RFK. And so, yes, tariffs are a health story in large part because when people lose their jobs and the economy goes south, they end up being in situations where the means of having good health go away. But then there's a more direct cost. don't forget that healthcare is a big part of the economy, about 20% of the economy. And you think about all of the tariffs being slapped on medical devices, for example. That's going to increase the cost of those medical devices, which, guess what, are going to back up on hospitals. That's going to translate into higher healthcare costs. That's going to translate into higher copays and deductibles for insurance. And that's going to mean people get priced out of healthcare. And so this is a healthcare story. And again, it's just part of the chaos, all because of one man's disastrous decision making. And we all have to suffer the consequences. And I just want to be clear about something. These aren't things you can really take back, right? Like, even if you were to go back tomorrow and be like, I'm just kidding, the damage has been done, because what we have now is a level of instability, which is going to slow down a whole lot of what our economy is made out of. And I say this as somebody who's not a huge fan of huge corporations. I would much rather our economy be about small businesses, but still, this ain't the way you do it. So I'm worried. I really am worried, because the people who are going to face this hardest are folks whose stories don't get told, right? They're not the folks who are on CNBC. They're not the folks who are panic selling stocks. These are good folks out there working a job, trying to earn a decent living for their family, and are going to watch their prices go up and their jobs get dashed. And that's a really sad thing for their lives in every single way. All right. I do want to now move to the other very sad story in public health, because I guess that's what we do here on this podcast. Let's talk about measles in Texas. Katelyn, we had a third death this week. Can you give us a sense of where we are with this outbreak and some context around that news?
Yeah, so as of Saturday, so a few days ago, we are well over 600 measles cases nationwide, over about 569 in the Panhandle outbreak, which includes Texas, it includes Oklahoma, it includes Kansas. Right now, it may include now a new case in Colorado that's linked to the Mexico outbreak, that was linked to the Texas outbreak. I mean, it's spreading. RFK Jr. over the week said that cases are flattening, and that's just not the case. They continue to grow incredibly rapidly. And you're right. I mean, it has costs, right? There's a reason why we vaccinate against measles. And one of them was brought to light this week with an 8-year-old girl who died in Texas. She was not vaccinated against measles and also had no underlying health conditions. She was previously healthy. So, it certainly could have been prevented. It's an incredible tragedy, and we're going to see more and more cases as this year goes on. We are only in April, and we've already surpassed 20 of the last 22 years of annual numbers of measles. So we're coming in hot this year.
That is devastating. And the thing about it is that, again, our statistics are just a way of measuring the devastation here. And one of the things you brought to light in your Substack this week was that even the statistics we're seeing are likely an underestimate of the real burden of disease. You've talked about that a little bit on the pod, but I wanted to ask you just to explain why it is that the numbers we're seeing may be the tip of an iceberg whose mass is a lot bigger than what we see.
Yeah, I mean, I had this hunch after the first death, a little more after the second death, and after this third death, I'm like, I do not think we're seeing the full picture here. And the reason for that is because we typically see 1 to 3 deaths per 1,000 unvaccinated cases. So 3 deaths should suggest between about 1,000 and 3,000 more cases, not the 569 that we have. The other thing that's really interesting that's happening with this outbreak compared to previous years. So since we eliminated measles in 2000, we've only had 3 deaths. And all 3 of those deaths were among immunocompromised patients, which are also incredibly tragic. But the situation is just different this year, right? It's younger kids, it's healthier kids that are dying, and it's happening more often. And so I think that this outbreak is significantly underreported. I would guess, honestly, by like times 10. And that would mean one of the largest outbreaks we've had in decades. So, we don't have a good picture. Not a lot of people are coming forward to get testing. People are scared. People are very distrustful of institutions. And So we don't know where we are in this outbreak, but I think one thing is clear that we are in a new, very unsettling territory, and it's going to take a lot to go back.
Yeah, I really appreciate you laying that out because, you know, I want folks to understand that it's easy to miss a case of measles. It sounds kind of crazy to think, but in an underfunded public health system where people may not come to care or be willing to engage with authorities, there are likely cases that go unmissed, but it's hard to miss a death, right? And so what you're doing is you're using those death numbers plus what we know about the natural course of measles to back translate what you think is the real burden that we're missing. And just, for context that folks have to remember, this is the most transmissible virus known to humankind, right? And so for every one of those cases that we may be missing, think about how many more cases that can go on to develop from that. So the fact that we're missing cases, right, and that can be demonstrable just from basic calculations like the one you did, Katelyn, that suggests to us that we may be dealing with this for some time moving forward, because it means that there are people who are getting the illness, not quarantining, and potentially passing it on to other unvaccinated people. And then the other thing that's just important to remember is that there are two viruses happening here. One is measles. The other one is mis and disinformation, right? These things tend to go along, right? Measles tends to ride on the mis and disinformation that creates the situation where there are more unvaccinated people in a community. And so this is bad news when you have subterranean spread of a virus. And it just suggests to us that again, the less able we are to cap it where it is, the more likely it is to continue to spread. And I really appreciate you sharing and explaining that.
Yeah, and I mean, the only way, honestly, to get a measles outbreak under control, actually, there's two ways. One, you vaccinate your way out of it, or two, it just runs out of embers to burn. And the Department of Lubbock health director continues to say she thinks this outbreak is going to happen it's going to take more than a year to take it under control. And that means we're going to lose elimination status, right? You lose elimination status after 12 months of sustained transmission from an outbreak. And that basically means we're going into endemic times. We'll see how this all plays out, but I'm not liking the force of infection at this point. I mean, and like you said, Abdul, something that is woven into this entire response is really mixed signals coming from Health and Human Services, right? On Sunday, though, RFK made one of his most direct vaccination appeals yet, writing on social media that the most effective way to prevent the spread of measles is an MMR vaccine. I thought it was interesting he didn't use the word safe in there. He also didn't tell everyone that they need to go get vaccinated. But Abdul, what did you think of that statement?
Those are two very astute observations, Katelyn. You got to imagine part of him died to say that. And it's also a crazy thing. I want to step back for a second. We're covering the fact that the American Secretary for Health and Human Services, in the midst of one of the worst measles outbreaks in recent history, said that the MMR vaccine is effective.
And we're excited.
And we're covering that as news. Sometimes things are so normalized in a certain way that you kind of have to just step back for a second and be what are you going to slow clap him out? Right. It's insane. Right. And it speaks to just how absurd this moment is, that we actually have to talk about this, because yes, of course he should be saying it, and he should be saying safe, and he should be going on a nationwide tour to encourage families to vaccinate their children because a third person just died of this preventable disease. Of course he should, but that's not what he's doing. And so, I will always applaud people saying the truth. Thank you for saying the truth here. But also, he's doing almost everything he can in his actual actions to backpedal on that truth, right? One is to dig up this old, profoundly disproven conspiracy about a disproven connection between autism and MMR, right? They're trying to dig this back up and drive this conversation in a moment where it is deeply irresponsible to do. Second, it just shouldn't be this hard to get your leaders to say the basic truth about the thing people can do to protect themselves. And so, we play stupid games and win stupid prizes. And unfortunately, this is what we've got right now.
Yeah, Abdul, I think it's interesting. So 4 hours after he wrote that tweet, or X or whatever we call it now, he followed it up saying that he praised doctors in the community for treating measles with treatments that have no evidence behind them. And what I think RFK Jr. is trying to do is make everyone happy. And it looks ridiculous. It looks absolutely ridiculous. And we're not only calling it out, Maha is calling it out, right? Some of Maha fans were pissed. He said the MMR vaccine is effective. And so it just goes to show, like, honestly, how important just communication 101 is, but also fascinating to see the highest office in our US government and health try to make both parties happy with some of this language. And it's at the center of it are these communities that are being exploited and people are dying, and it's a tragedy.
It is. You know, but there are heroes in our midst, Katelyn, and one of them is Dr. Peter Marks. He was the FDA's longtime vaccine expert. I want to share with you a clip about what he had to say about RFK's messaging on CNN. Take a listen.
I'm just going to say this, and I'm not going to directly confront Mr. Kennedy. He'll have to confront his maker for those lies. I just need to say to you, as if I was under oath, the vaccines that make it through the vaccine approval process in the United States are, not every vaccine is safe, but those that make it through the approval process are safe, effective, and are high quality. No one at FDA would ever let a vaccine out that they would not give to their own children.
That deserves a slow clap. See, that's what we need to hear. Thank you, Peter Marks. Appreciate you. Really wish you were in public service. Hope that you get there again. Also, you tell him. And man, that point about meeting his maker, like, is really true at the end of the day, right? It really is true. Is at some point there ought to be some accountability somewhere, and you hope that people who leverage their positionality for fame on the backs of lies should at least have some shame somewhere. I want to, ask you, right, because probably the most disturbing point here is the propaganda that vaccine skeptics are spreading about children who died, literally families who lost their kids. Katelyn, you wrote a bit about this in the newsletter. What did you learn?
Yeah, I mean, there's no doubt that people that spread disinformation, right, which is the false information intended to mislead, right? They know that they're doing is wrong, is becoming incredibly emboldened with this measles outbreak. It's actually incredibly fascinating to watch. Children's Health Defense, which is an anti-vaccine organization, which was founded by Secretary Kennedy, is really just no longer operating on the sidelines, right? They built a fake CDC website. We talked about that a few weeks ago. They've actually started deploying crisis teams where these measles outbreaks are happening. They're showing up at the same places as the CDC response team. And with this latest death, Robert Malone, which is a prominent anti-vaccine figure, very closely aligned with Children's Health Defense, broke the news of this death on Saturday, a day before Texas Department of Health, a day before CDC, a day before HHS made any public statement. It's very clear to me that they're trying to control this narrative. And Malone is blaming basically this child's death on medical errors, right? Not measles. It's a textbook disinformation move to attempt to redirect blame or obscure the preventability of this disease. And this isn't the first time that they've been trying to shift this blame. This actually happened also with the first child's death, that they tried to blame the doctors or the hospitals, and pushing the same narrative. And this idea that these deaths are due to medical errors is one, not based on any sort of facts, but also just actively discourages people from seeking care, right? This is an incredibly dangerous message to send to vulnerable communities. And I cannot believe they are pinning physicians and hospitals that are there to help protect people, and sowing more distrust. It's incredible. And, I don't know how we get ahead of these bad actors rather than rapid response, radical empathy, and building trust before an emergency gets there. I don't know how much more public health can be doing in the moment on the ground in West Texas. Don't know if you have any
Yeah.
thoughts on that, Abdul.
I think this is one of those points where we need physician voices to be
Yeah.
loud and out there, right? Because it's insane to think that you got these folks out here spreading lies about vaccines that can prevent diseases and then blaming doctors after people get sick because they died, right? It's like it literally is arson. And I think it's time for physician voices to call out the arsonists. You are literally allowing this fire to burn. It's like you're giving it more firewood. And then when the firefighters can't prevent it, you're blaming the firefighters. And it's unfair. It's wrong. And I do think that doctors have some moral authority to be able to step up and say, hey, listen, like we are out here fighting the good fight and putting ourselves on the line. And you're out here making it worse.
Yeah, I mean, Abdul, I think that was my first thought too. And I'm curious what you think about this because he knows this one-sided silence, right? He knows the hospital and the treating physicians can't respond because of HIPAA. He uses that silence as a proof of guilt when in fact it's a legal requirement meant to protect the patient and the family. And so I think that, I agree with you. I don't think the hospital can do much. I don't think the doctors can do much, but you're right. I mean, this moment requires surround sound, right? Other physicians can be stepping up. The only physician name that keeps popping up is that one doctor who is shipping in vitamin A to West Texas. Like, where are the other physicians' very loud voices right now in that community, right? It doesn't matter if it's Katelyn Jetelina on PBS NewsHour, right? It has to come from within that community, from people that they do trust.
Yeah, I think that's exactly right. I think it's physicians in the community who didn't necessarily take care of those patients or aren't involved in the care, but who could be, right? And those are the voices that I think people need to be hearing from right now. America Dissected is brought to you by the De Beaumont Foundation. For 25 years, the De Beaumont Foundation has worked to create practical solutions that improve the health of communities across the country. The foundation advances policy, builds partnerships, and strengthens systems to give everyone the opportunity to achieve their best possible health. To learn more, visit debeaumont.org.
Okay, next topic. We learned the Trump administration will not reimburse people on Medicare and Medicaid for the cost of the GLP-1 drug. What are they called, Abdul?
Ozempic and Wegovy.
Yeah. So what's the story here, Abdul?
Yeah. So right now, Medicare and Medicaid do cover GLP-1 agonists if they're used to treat diabetes, sleep apnea, and certain heart issues. Now, to explain why, right? These are all diseases that sit downstream, are vastly increased in probability by the condition of excess body fat, right? And we know that GLP-1s, they have a direct impact on these diseases, but they also have part of that impact through their effect on increasing satiety so that people don't want to eat as much and ultimately end up losing weight. And that is critical for addressing diabetes, sleep apnea, heart issues, etc. But I also want folks to think about this. Even if you have excess body fat, but you have not developed diabetes, sleep apnea, heart disease, whatever, there's still the added risk that you will. And so there's an incentive to prevent that from happening, right? And so it's important to realize that, yes, these are pharmaceuticals that treat a condition and a set of diseases, but it's also important to realize that they're also secondary prevention against other diseases. And so it would make sense for Medicare and Medicaid to prevent people from getting these diseases because they have long-term consequences that we call sequela in our line of work, right? But the administration here, they're trying to be a penny wise and a pound foolish. And so they're trying to bar these federal programs from covering GLP-1 agonists for people who don't yet have these diseases. And so to me, it just doesn't really make much sense, especially considering the fact that these are drugs that a lot of people could benefit from. Just to put in perspective, more than a quarter of people on Medicare and Medicaid meet clinical conditions of obesity. And so you'd think that you could use them to get ahead of a problem, right? Prevent these diseases and ultimately save these programs a lot of money. But it's just in line with the way that this administration has thought about their approach to quote unquote government efficiency. And so I'm not surprised that this is happening. but I do find it foolish. And frankly, a lot of folks are going to end up in having conditions and diseases that could have been prevented if we were a little bit more thoughtful. That being said, I want to be clear about this. The fact that these drugs are as expensive as they are is a huge problem. And that's in part why we want Medicare to be able to negotiate the price of prescription drugs for people on Medicare. So you can bring the prices down, but then the administration, right, Trump and his friends don't like that either. So it's like, listen, we're going to allow these drugs to be really expensive. And because they're expensive, we're going to keep you from having them, which just makes no sense at all. Anyway, let's just add that to the list here.
And that's because, like, honest question, that's because once Medicare and Medicaid determine a price, everyone else kind of falls in line with the health insurance world. Isn't that right? It's used as a baseline.
That's right. So most insurance companies will peg their prices to Medicare and Medicaid. Just remember, Medicare is the biggest insurer in the country. Like, there's this lie that we're told all the time that we have a private health insurance system. We don't. Most of the billing for all of healthcare is done via Medicare or Medicaid. More than 60% of all dollars spent in our healthcare system are spent by the federal government. We just leave the most lucrative part to private insurance to be able to profiteer off of. And so what tends to happen is, because Medicare is the biggest fish, when they set a price, everybody else kind of pegs to that price because they're such a big fish. And so this has huge reverberations across the board. So in trying to oppose Medicare drug price negotiation, the administration is giving a very clear giveaway to the pharmaceutical industry, right? But at the same time, they're saying we're not going to cover these drugs, which is it's punching yourself in the face with one hand and then trying to rub yourself and make yourself feel better with the other. It just doesn't make any sense. So with that, Katelyn, with all the bad news here, we do need something a little bit refreshing. So can you close us out with some good news?
There is good news. And we're starting to see courts really catch up with this administration, particularly around public health, or, like, at least that's what we're at least trying to keep track of. One of the biggest wins was a federal judge permanently barred NIH, National Institutes of Health, from cutting indirect costs to universities and academic medical centers. As a reminder, indirect costs are what as a researcher, what we get on top of grants to help support infrastructure to do a lot of our research, like, keeping the lights on, or having a team check up on ethical and human standards. And so this is a really big win for universities, as well as scientific researchers that just don't need or want their science shut off because universities won't be able to afford it anymore. In her ruling, the judge wrote that Trump's policy violated the Administrative Procedure Act. It requires the president to follow a process. Get that, Abdul, following a process before cutting off an insane amount of funding to scientific research in the United States. Of course, this is going to get appealed, but for now, it restores just billions of dollars of grant money to our medical research facilities, and thus to local economies in each one of our states and each one of our hometowns, because universities employ a whole lot of people. There is another piece of really good information for public health front. 23 state attorney generals also filed a lawsuit to stop the $11 billion rollback in Health and Human Services funding. And it buys local health departments at least 14 more days. We'll see how much longer it is of spending authority. I'm really hopeful for this because, as you listeners know, as you don't know, all of this money was already allocated by Congress to local and state public health departments. They had about a year or 2 more years to spend it down. And so we'll see what the judge says, but we'll also see how Congress reacts to that as well. So yeah, that is some hope. We'll continue to follow how that impacts public health.
Yeah, and I don't want to be a wet blanket because we wanted to finish on some hope, but this is going to be appealed and it's going to go to the Supreme Court, and they've made a couple of disappointing decisions. And I just want to offer folks some context on this. There's this dance happening between the courts and the Trump administration. On the one hand, the Trump administration is issuing a warning, in effect, saying that if you oppose us too much, we may just violate the rule of law and not obey your orders. And the court is saying, well, maybe we don't want to take that risk because once they violate, our power basically goes to zero. And so what they're doing, in effect, is they're bullying the Supreme Court and other courts in ways that are a bit tacit so that they maybe save their most oppositional rulings for the biggest things, which means that, unfortunately, it's likely that those who are suing the administration may face losses in the courts. Now, we'll see where this goes. I do hope that this continues to win because there is so much critical life-saving research that is being done at universities. And that takes me to the interview that I got to share with actually a good friend from grad school, my good friend Scott Hugo. And we had Scott on the show. I remember him as being one of the most energetic, enthusiastic, kindest, smartest people I've ever met. And for a little bit more than a year now, he's been suffering the consequences of pretty devastating long COVID. And he didn't get it in 2020 or 2021, right, during the height of the pandemic. He got it much later in his first known case of COVID. And it just highlights the fact that, and let me tell you, this has just completely changed his life. We only really had 20 minutes with Scott before he started to get really bad brain fog and would suffer the consequences for like days on end. And so, we had to cut the conversation short, but he gave us a really, really important and poignant view into what his life with long COVID's like. And I raise this because I think given the 5th year anniversary of the pandemic, a lot of folks want to pretend like this is over, right? And yes, maybe the pandemic era of COVID-19 may have come to an end, but the consequences in people's lives, the long tail of the pandemic in terms of chronic disease and disability, that's living on in millions of people like Scott. And I wanted to highlight this because their hope is that we continue to fund and invest in research to try and understand how long COVID happens, why it affects so many people, and what we can do to treat it and give them back the kind of lives that long COVID took from them. So I really wanted to make sure that folks got to hear Scott's story. He is, even as he mentioned, he's got about 10% of his cognitive capacity. Even with 10% of his cognitive capacity, he's more articulate than I'll ever be on my best day. So I hope that folks will stick around and hear what Scott has to share because, this could be any of us, right? And we don't know, with COVID going endemic, we don't know when we might get that infection that takes away so much of the health that we take for granted. So with that, Katelyn, I'm going to ask a question because clearly you're in a hotel. Where in the world is Katelyn San Diego?
Hello from New York City.
Live from New York. It's Katelyn
anyway. From New York. Going to be talking with the New York Department of Health tomorrow. And then we have a crazy comedy show and community engagement for your local epidemiologist tomorrow night. So I'll report back next week to see how that goes.
Let me know how it goes. I appreciate you inviting us to laugh so that we don't cry. There's that famous meme of the little boy who's laughing hysterically and then starts crying. I hope that doesn't happen to you, to the audience. But no, thank you for giving us some cause for laughter and levity, and enjoy your time in New York. All right, friends, we'll see you all next week. Friends, I don't know how many times I've told you how much I love my Quince sweaters. I mean, that beautiful Mongolian cashmere, how can you go wrong? Sadly, sweater season is passing, but that also means that it's spring and sunny, which I don't mind. Vacation season is nearly upon us, and just like my sweaters, this year I'm treating myself to the luxe upgrades I deserve with Quince's high-quality travel essentials at fair prices. These include lightweight shirts and shorts from $30, pants for any occasion, and comfortable lounge sets, with premium luggage options and durable duffel bags to carry it all. The best part? All Quince items are priced 50 to 80% less than similar brands. Quince partners directly with top factories, so they cut out the middleman and pass the savings on to us. And Quince only works with factories that use safe, ethical, and responsible manufacturing practices and premium fabrics and finishes. I love that. For me, it's all about a good t-shirt, so I love the fit and feel of Quince t-shirts. I also love their luggage, well-designed, durable. It gets me and my stuff from point A to point B, and it looks good doing it. For your next trip, treat yourself to the luxe upgrades you deserve from Quince. Go to quince.com/AD for 365-day returns plus free shipping on your order. That's QUINCE.com/AD to get free shipping and 365-day returns. Quince.com/AD. Before I jump in, I want to just share something about Scott. Scott has been disabled by long COVID for over a year, and he remains unable to work. Long COVID can cause over 200 distinct symptoms, and Scott experiences a dozen of them, including severely limited cognitive endurance and relentless fatigue. We kept our conversation at 20 minutes to accommodate the disability, and I'm just so grateful to him for joining us and making the time. I know that the recovery from a conversation like this can be long, and so Scott's giving us a lot more of his time than it might seem on the interview. So Scott, can we jump in? Can you introduce yourself for the tape?
Absolutely. My name is Scott Hugo. I am 38 years old, born in the Bay Area and back home in the Bay Area. Prior to long COVID, I served as a housing justice attorney with the city of Oakland. And as Abdul, as you highlighted, for the past 13 months plus, I've been disabled by long COVID and not only unable to work, but mostly housebound during that time.
And Scott, listeners won't know this, but you and I go back to our time together in Oxford. We were in the same Rhodes Scholarship class, and the Scott Hugo I remember is one of the most energetic, driven, hard-charging people that you'll ever meet. Also one of the most principled and the kindest. And I've watched your journey through long COVID. Can you share a little bit about what the contrast is for people? Because I think when we talk about long COVID, it's easy for folks to think of it as a disease, but also like it's taken on a whole bunch of constellations. And I think the contrast between your experience before and after, I think, is really what we want to drive into. So what is that contrast like?
Absolutely. So one of the best ways that I've heard someone capture this, not for long COVID, but for a chronic illness kind of more generally, is Suleika Jawad in her memoir, Between Two Kingdoms. She mentions bifurcation, essentially that there is a line that is divided in your life with a clear before and a clear after. So prior to February 18th, 2024, I was, building investigations and cases to enforce tenants' rights to safe, healthy, and dignified housing. I was working full time, doing personal writing in the mornings, exercising, working out, maxing my schedule basically as much as I could. In many ways, Abdul, you'll appreciate this. I still had a bit of the Hamilton nonstop kind of dynamic to my life. And then from February 18 onwards, it's been like entering another, like a parallel universe, to be entirely honest. There's the life I had before, and then there's the life that I live now. And I would want to convey to listeners how severely disabling long COVID can be. And the way that I kind of think about it is that it can be life altering, which it has been for me. It can be life shattering for people, and we can talk a little bit more about that. And it can be life ending for others. And so for me, because I am incredibly privileged, I'm spared the worst of this. And even then, I'm unable to work. We are trying to make sure that we're paying the rent on our rental home. I rely on my partner as my caregiver and family. What I'm able to do in a single day is probably 10% of what I could do prior to February 18th, 2024. And I can share more on the symptoms, but I'll stop there.
I really appreciate you sharing, and that's also just as somebody who's a friend and knows you. I can't imagine the frustration of that. I can imagine as somebody who has been so defined by the boundless energy that you've always had, having to spare your energy and not being able to get up and do the things that you want to do. That's got to be just extremely painful to have to manage and negotiate every day. I want to ask a little bit about your symptoms. You talked about fatigue. What's that like? Like, I want to understand So when you realize you've run up against your energy limit, what does it feel like to you?
Yeah, uh, it is like nothing I've experienced before. And just as context, because I know it's easy to hear people say this, and then I was in the kingdom of the healthy most of the time prior to this, and so I know how easy it can be to discount it from your own personal experience. But I played football and I played rugby prior to this, and I I would do full day hikes of like 15, 16 mile day hikes, lots of climbing mountains essentially. The fatigue that comes with this is something more vicious and brutal than anything I had experienced at the end of an 80-minute rugby match or a full day hike. If you push, and I speak from my experience here, but I know that others share it, you're constantly asking, can I do this or can I not? Am I going to go too far if I do this? Because if you go too far, there's this phenomenon called post-exertional malaise, PEM, which is in many ways a living nightmare in that if you go a little bit too long or too hard, or you try a task that you think that you're able to do, you not only feel exhausted, wiped out, potentially bedridden for the rest of that day, you could be knocked out for days, weeks, or even months
Mm.
at a time. And so every choice that you make has these potentially major ramifications for how you can function day to day. And every morning I wake up and I've got a day planner where I write down cognitive activities for the day and physical activities for the day. And I try to figure out what has to be done. Um, and I never get through that list. And that's even with triaging, prioritizing, etc. Um, it really teaches you to have to be adaptable and flexible every single day, because you wake up in the morning, and in the chronic illness community, we refer to spoons, like spoons as units of energy. You wake up in the morning and you never know how many spoons you're going to have for that day.
Hmm. I want to ask you, you know, we've just observed the fifth anniversary of COVID-19, and for a lot of folks, that is something that, by their privilege, is in the rear view. For you, it's not. It is a day to day. What are we getting wrong about the experience of COVID, and what does it mean to get it right?
So I'll start with what it means to get it wrong. I think first and foremost, and I know people don't want to hear this, but the pandemic isn't over. Uh, Long haulers such as myself, but especially people who've been living this for 4 to 5 years, we live the reality that the pandemic is ongoing each and every day. And so I shared the example of I was disabled by long COVID with my first documented COVID infection in February 2024. That was long after, states and I think the federal government had declared an end to the COVID pandemic and emergency. So I was disabled by this illness when we had supposedly resumed normal life. Individuals are continuing to be disabled by COVID today. Advocates, such as advocates from ME Action, refer to it as a mass disabling event that is ongoing. And so, just to share some numbers on this for listeners, a year ago in April 2024, the Long Hauler Advocacy Project estimated that there were over 60 million individuals in the U.S. who were living with long COVID, and over 15 million of them were like me, where we experienced severe daily impairment, inability to work, inability to go outside and engage with the world. And so I think first and foremost, we just have to acknowledge that as inconvenient a truth as it is, the pandemic is not over, and that we as a society have a collective obligation both to those who have continued to suffer for years on end and those who are continuing to be harmed today. Another inconvenient truth I would share with listeners is that each infection that you get increases your risk of long COVID. And so I know many people, have had COVID 2 or 3 times, and they'll say it's just like the flu. in general, not always, but in general, the flu does not do this to you. And I know of long haulers who was on their third COVID infection after no issues the first couple of times, who then became severely disabled. So I think the first thing, we talk about historically with injustices, et cetera, on truth and reconciliation. I think that, one of the first things that we as a society need to do is to acknowledge the fundamental truth that the pandemic is not over, that the damage and the repercussions are ongoing, and that that damage and repercussions are especially harmful to the most marginalized, to those that do not have the privileges that I have, that buffer you from the worst of this experience.
And what would you, I mean, it's a hard moment to contemplate the government getting things right, particularly when it comes to vulnerable people. But if you could be president for a day and you could get us moving in the right direction on this issue, what would you do?
Well, one thing I would do first and foremost is, and I know I will articulate a positive vision, but I also want to highlight some things that exemplify what are the opposite of that vision. So after a long period of time, HHS had set up an advisory committee on long COVID policy. And this advisory committee was staffed with experts, with long hauler advocates. And it had just been formed in January. I think their first meeting was in January 2025. One of the first actions of the Trump administration and of Secretary Kennedy was to disband this committee. So if I was the president, I would be doing the opposite, which is be bringing in advocates, bringing in experts, bringing in the different organizations that harness the lived experience and utilizing them to help inform comprehensive care, treatment, and solutions. Another thing that I would do is that, one of the things that I live personally is, as a housing justice attorney, I saw desperation in housing, where I saw, people living in unconscionable conditions because they needed a roof over their head, and predatory individuals taking advantage of that. I now have an understanding of that kind of desperation when it comes to healthcare and to chronic illness. I'm 13 months in, I'm privileged, but at this point in time, I will do or try just about anything to stem the series of losses that comes with an illness and a disability like this. And part of that is because, obviously long COVID is relatively new in the public health landscape, but we have no FDA approved treatments or let alone cures at this point in time. And so I want to specifically highlight the work of Lisa McCorkle, Hannah Davis, and the Patient-Led Research Collaborative, which is a long hauler and allied group organization, where they've really highlighted the need to continue funding research and clinical trials. This is not abstract for me. Next Thursday, I will be going to UCSF to their long COVID clinic to get a brain MRI scan because of the severe neurological and cognitive issues that I'm facing. And so that funding was recently jeopardized by the Trump administration, and thankfully advocates and a coalition of principled legislators came together to restore the clinical research funds. But at an exact time when, many long haulers that I know, I think the public needs to know the extent of suicidal ideation it's heartbreaking, it's appalling, it's unconscionable, it's a crisis. And for so many, especially when I look at, long haulers that are in their teens or their early 20s, they are desperate for hope because they are now experiencing this illness where they feel like they never had a chance at life to begin with. And these research teams that are conducting these clinical trials, some are working out, some are ruling out other treatments, but they are providing critical sources of hope for us. So this is a long answer, but I'll share one more thing, Abdul, because I know that you were recently covering it on the podcast. we were talking about SSRIs and how that's been in the sort of crosshairs of this new administration. I understand people have very different experiences with them, but I'll just speak from my own experience. A year ago, in April 2024, I was in the depths of the worst of my symptoms and what I would refer to as the cognitive darkness. I could not look at a screen like this. I could not hold a conversation for more than 5 minutes. I could not read. It was one of the most
Hmm.
brutal experiences of my life. A team of researchers at the University of Pennsylvania had conducted a study and found that long COVID potentially interrupts your serotonin mechanisms. Based on that, my PCP prescribed me fluoxetine, Prozac, SSRI, and I would credit that with getting me out of the worst of the cognitive darkness.
Hmm.
And so I just want to, again, I'm privileged here, but there is a personal stake when we talk about funding and research for these clinical trials to try to, at the very least, improve the quality of life for long haulers and others with chronic illnesses, let alone to find a cure.
I really appreciate you sharing your experience because I think the hard part is, and this is something I've grappled with, the paradox of big numbers is that they depersonalize experiences. And I think people forget that under all of these numbers, the potentially tens of millions of people in our country alone, that each one of them has their own experience, own story, their own struggle, their own life that they got ripped away from. And I just really appreciate you sharing that. Um, I guess my last question to you is, what is your message to other folks who are dealing with long COVID? What do you become a leader in the community, and credit to you, Scott. If there is a community that needs leadership, it's always going to be you who jumps to the front, and I appreciate that, or is pushed to the front. But I want to ask, what's your message to other folks in your situation, and how do you all find hope in times like this?
Absolutely. So first, I will share that, and by the way, just for accuracy for the audience and for everyone here, my cognitive symptoms are starting to kick in. So at about 15, no, I can continue to finish this, but at about 15 to 20 minutes, I start developing head pressure, and then that head pressure becomes the equivalent. If I don't stop, it becomes a brain ache that's like a
Mm.
concussion, like I had sustained a concussion. And so this goes to that delicate dance that we have to make every day of how far can I push? What's too much? Am I going to wipe myself out? That being said, um, one thing I want to say at the outset, and I really appreciate your kind words, I do want to acknowledge my debt to all of the long haulers and advocates, especially the first waivers who have been fighting in this for years, some of them for 5 years at this point in time. I also want to acknowledge my debt to the other chronic illness and disability justice advocates and organizations. It is because of them that this experience has not been a living nightmare for me.
Mm.
Because of them that I am able to enjoy some measure of rights and support through this process. And so I want to acknowledge my debt to them and to share that part of the reason why I do this is because I feel a personal responsibility to them and to all of the others to come. On hope, what I would say is first and foremost, the spectrum of experience as long haulers is so vast and so different. And so, I'm coming from this position where I have relatively stable housing, you name it. I mentioned that long COVID can be life shattering, but there are individuals that are forced into bankruptcy because of medical bills, individuals that lose their housing, partners who leave, families who leave, um, careers that are completely ended, you name it. And so I want to acknowledge and validate that suffering first because it's it's dark and difficult, a life as a long hauler or as someone with in many sort of experiences of chronic illness. What I'll say is that one of the things that I had a coin at my bedside and I've kept with me and I repeat it basically every morning is that while I breathe, I hope. And it's the belief that as bad or as difficult as things are right now, there's always the possibility of change. And that with each day that passes, I am so grateful to the advocates that are organizing and spreading best practices. I'm so grateful to the clinical research teams that are working tirelessly to try to make our lives better. And so for me, a continued commitment and the continued possibility of change is a profound source of hope. I would also say one of the most decisive sort of experiences for me was when I finally regained the cognitive ability to tolerate screens in short doses. It gave me an opportunity to tap into the online long hauler and chronic illness community. And the truth is, when something like this happens, you do not get through it on your own. Independence is an illusion when something like chronic illness and disability come into your life. It really underscores the reality of interdependence, and being able to be part of this community, to learn and to have solidarity alongside so many others that are experiencing this fight, that is a source of hope and of strength for me. One last thing that I would add in is just, and I think it's important to say this, that the messages that this administration has been sending are that they do not care about us and that we are disposable. Karen Bischoff in the Long Hauler Advocacy Project talk about how long COVID and our experience is being erased in real time by this administration. And in my mind, this is reflective of a broader pattern of desensitization and dehumanization that is going on against so many groups and communities out there. And so what I would say to, if there are any other long haulers or individuals with chronic illness listening to this, I want to underscore that no one is disposable. And one of my commitments, and it's a shared commitment, is that no one is left behind. And so as dark as it is, every day is a new chance. Hold on, stay in the fight, and know that you're not alone. And we are going to do everything we can to honor your humanity and your dignity and to help you to live and regain the life that you deserve.
Scott, even at 10% capacity, you remain one of the most thoughtful and articulate people I know. So I just really appreciate that. And I think that's a great place to end it. Our guest today was Scott Hugo. He is a housing justice attorney who 13 months ago came down with long COVID and has sought to use his voice to advocate for the needs and well-being of frankly, all of us, because even if you don't suffer it now, there's still the risk that you could. And fighting for the health of any of us is fighting for the health of all of us. So Scott, thank you so much for your time, for your energy. I know there's not much of it, and I just really appreciate you sharing it with us here today.
Abdul, thank you, and thank the America Dissected team for shining a light on this and for caring. It means so much to us each and every time an individual on a platform such as yours spends time and resources to talk about this, to raise awareness. That's part of the reason why we have hope. So thank you.
Thank you. That's it for today. You can find more content on our website, incisionmedia.co, and check out our shop at store.americadissected.com for our America Dissected merch, including logo shirts, hoodies, and mugs. And please don't miss out on our Make America Scientific Again dad caps. If you've got guest recommendations for the show, send us an email at info@incisionmedia.co. You can follow or subscribe to America Dissected on your favorite podcast platform and on YouTube at America Dissected. It's no dash. And you can follow me on Instagram, TikTok, and yes, X, at Abdul and Scott, no dash. And make sure to subscribe to Katelyn's newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 readers. Search for Your Local Epidemiologist on Substack. Links to all of our sponsors are available in the show notes. I really do hope you'll check them out and show them some love. They make the show possible every single week. Finally, on your way out, don't forget to leave us a 5-star review. And if you're watching on YouTube, drop us a like or a comment. Word of mouth still goes a long way too. So if you know someone who might like to keep up with everything that's happening in the world of health, please do let them know. America Dissected is a product of Incision Media. Our co-host is Dr. Katelyn Gentilino. Our producer is Andy Gardner-Bernstein. Video and audio editing by Nadine Melkonian. Our theme song is by Taka Suzawa and Alex Sugiura. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Our executive producers are Tara Knight and me, Dr. Abdul Al-Sayed, your host. Thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice. It should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.